Hi, I'm Dr. John Heary, and today we're going to be talking about the thyroid gland and hypothyroid. How do you know if it's, really a low thyroid or medically called a hypothyroid or hypothyroidism? Um, did you know that the thyroid medication topped the list of prescription drugs dispensed in the United States in 2015? And it's one of the top dispensing drugs year after year. For many, symptoms, they're not improving when they're put on thyroid medication by their doctor. However, most of these people, still affirm that they're tired, that they're exhausted. They have trouble losing weight, trouble getting motivated. Um, there's a doctor. His name is Dr. Juan Brito. He's an endocrinologist at the Mayo Clinic, and he said that it's a strong signal that the thyroid drugs are overused medications. He said some people really need this medicine, but not the vast majority of the people who are taking it. As people age, they tend to see their doctors more. Many patients will have the complaints of fatigue, low energy, weight gain, constipation, mental fogginess, etc. Clinicians will typically order a TSH, or what's called a thyroid stimulating hormone, and T4 on blood tests as part of a routine panel. Now, the pituitary gland detects low thyroid function, and that's indicated with a low T4 and more so with a low free T3. In response to low thyroid function, the pituitary gland produces TSH to stimulate the thyroid to produce more T4 hormone. The T4 then needs to be converted into the more active form, which is the free T3, which can then be used by the body. If you have a high TSH and a low T4 or T3, that typically indicates a common low thyroid function. And usually thyroid medication is going to be prescribed. Even when TSH and T4 readings are only slightly outside the clinical ranges. So, slightly elevated TSH may represent a normal consequence of aging or maybe even just a temporary problem. Patients, with these test results rarely develop serious hypothyroidism. Many people relate weight gain to low thyroid, but there's a number of other signs and symptoms that low thyroid can cause. Some of the more common ones are depression, fatigue, chronic fatigue syndrome, fibromyalgia. It can cause anemia, infertility. It also causes cholesterol to elevate as well. It can accelerate your aging process. It can cause muscle weakness, stiffness, and those are just to name a few. The uh, the prevalence of hypothyroid symptoms, they can be vague and also non-specific. And this is one reason why so many people are placed on medication. So, if you're taking medication for your thyroid, but you're not feeling better, then you may need to dig or look a little bit deeper to find out what's going on. You really need to make sure that you're getting properly tested. The thyroid function should never be based on just testing the TSH and a T4 in the blood. Levels vary from day to day, even hour to hour, and they often stabilize on their own. You really have to look at a full thyroid panel, and other thyroid tests that should be included are going to be the T4, a T3, and the way it works in your body is that T4 converts to T3 outside the thyroid, most all tissues, with the liver and kidney doing the most conversion. In fact, 80% of the most active T3 is produced outside the thyroid. So, T3 is most responsible for increasing metabolic rate. The free T3 test measures it's the unbound levels of the hormone and what's available for use by the body. So, there's many environmental factors, illnesses, drugs that can affect the conversion of the inactive T4 into the active T3. Um, One of the most common causes for a hypothyroid, and some research studies say that it may cause 90% of it, is Hashimoto's disease, which is an autoimmune thyroid. And that can cause low thyroid function. It causes inflammation that will show elevated levels of various antibodies, typically like the thyroglobulin antibody, the TPO, may also cause the reverse T3 to go abnormal as well. Other factors to consider when the thyroid's suspected to, not to be working properly. You also need to check your vitamin D status. There's many research studies that show many people who have a low thyroid or hypothyroidism suffer from low vitamin D and low calcium, and that the degree and the severity of their low thyroid was associated with the deficiency levels. Now, the population of vitamin D deficient individuals, it's a lot higher than you might think. There's one study that showed that almost 82% of the autoimmune thyroid disease patients had low vitamin D. So, the question is, can low levels of vitamin D actually cause a low thyroid? And there's definitely a relationship. May or may not be causal, but researchers who presented their work at the American Thyroid Association annual meeting, and this is back in October 2014, showed that among the Hashimoto's patients in their study, a lower level of vitamin D was associated with a higher TSH level and a larger thyroid. The researchers conclude that low vitamin D is involved in the disease process that causes Hashimoto's thyroiditis, and that vitamin D and autoimmune thyroid diseases are linked. Now, you really need to make sure that you're getting your vitamin D levels tested. It's the 25 hydroxy vitamin D blood test. That's going to be the best way to determine your vitamin D status and also how much vitamin D that you need to take. Most of the time, adults can usually take about 5,000 IUs, which is safe. Infants and younger children, they should also have vitamin D checked as well. They usually can take around 400 IUs per day and have no issues with that. Also, iodine, L-tyrosine deficiencies. Did you know that thyroid cells, they're the only cells in the body that can absorb iodine? These cells are the ones that make T4 and T3, and you don't want too much iodine nor too little, and that's why iodine supplementation needs to be taken with precautionary measures and under the guidance of an experienced nutritionist that they will test properly. Just small changes in iodine intake are sufficient to reset the thyroid system. The recommended daily allowance of iodine it's 150 to 300 micrograms. So, to give you an idea of how little this is, 1 teaspoon of iodized salt contains approximately 400 micrograms of iodine. So, foods rich in iodine, that includes some of the more common ones or high ones are seaweed, kelp, chlorella, just to name a few. Now, L-tyrosine works with iodine to make T3 and T4. Now, all those, it's rare to be deficient in tyrosine. Foods that are rich in this amino acid include meats, fish, egg, nuts, beans. Now, selenium is also has a very important role in your thyroid function. Selenium helps antioxidants and enzymes, within the thyroid to control damage done by free radicals created from making T4. So, too many free radicals means that you're going to have too much inflammation. Now, if you have a selenium deficiency, then your thyroid's production of T4, it will be affected. And therefore, your energy is also going to be affected. Your metabolism is going to be affected. There's no consensus on the dose of selenium required, to optimize any person's thyroid function. However, a safe amount to take would be 200 micrograms daily. One thing you do want to be careful of is excess soy consumption. It can affect your thyroid function. If you have elevated thyroid antibodies or an autoimmune thyroid disease like Hashimoto's that's not being treated, be aware that soy can be a trigger for developing hypothyroidism. Now, there's a study. This is back in 2011, and it was published in the Journal of Clinical Endocrinology and Metabolism. And what they found is that people who have mild or subclinical hypothyroidism, there's a threefold increased risk for developing hypothyroidism with dietary supplementation of 16 milligrams of soy phytoestrogens. Now, if thyroid function is lowered by soy, then your pituitary gland is going to try and stimulate the thyroid to produce, and it's going to elevate your TSH. So overconsumption of soy is probably more common than you think. Be sure to make sure that you read all labels of foods and supplements. It's recommended that you avoid soy milk, soy nuts, soy protein isolate, soy cereals, and also in candy as well. In the U.S., people take in as much as 80 to 100 milligrams of soy isoflavones a day. And, you compare that to Asians, they only consume about 10 to 30 milligrams on a daily basis. So, if you think that you have thyroid dysfunction, when there's various, amino acids, proteins, hormones that are out of sync, there's a variety of diseases and symptoms that may appear. Altered thyroid function, can produce symptoms that are pretty vague. So instead of chasing symptoms, proper testing is advised to avoid taking medication or even supplements that you may or may not need. It's important to do a comprehensive blood test to detect deficiencies or toxicities that may be affecting your health. This testing is also important to know exactly what vitamins or what minerals that your body needs in order to work efficiently. Contact us today to get started, and we can help you improve your body safely and naturally. All right, we'll look forward to talking to you guys soon. All right, take care now. Bye.